an environmental epidemiologist, and my research looks at the relationship between environmental contaminants and its relationship with human health. A lot of my research is actually in Asia. I work in China and India, but also more recently in Latin America, looking at the exposures that people have to air pollution. So air pollution from cooking with biomass and coal inside of their homes, to traffic pollution exposure or industrial pollution. And I study the impact of that exposure on their health. But then we also look at what are the solutions and interventions that we can use to reduce their exposures. When populations are cooking with wood and coal fuels inside of their home, they're usually doing that in stoves that are traditional stoves that don't result in complete combustion. So it emits a lot of pollutants. And those pollutants are often the same pollutants that are emitted from burning oil or having traffic. So it's incomplete combustion. And about half the world's population cooks with these fuels. So it has huge impacts in terms of the amount of emissions that's emitted from cooking with these different stoves. And those pollutants are not only bad for health, so people breathe in the smoke while they're cooking, their family members breathe in the smoke, it goes into the communities, but it also gets into the atmosphere. And cooking with solid fuels is one of the leading contributors to climate change after greenhouse gases. And I don't think people necessarily think about that when they think about reducing climate-relevant pollutants, but household energy is a really important part of that picture.
The title of the talk is Air Pollution, Climate and Health in the Tibetan Plateau. And in a lot of ways, this particular presentation synthesizes much of what we've already learned in this series based upon some of the basics relating to weather and climate. But here we are having a presentation that examines some of the real human impacts of extreme weather and climate on human health. And this is a really, really important aspect of the topic for this series. So I'm pleased to present to you Professor Jill Baumgartner, an assistant professor in the Institute for Health and Social Policy and the Department of Epidemiology, Biostatistics, and Occupational Health here at McGill University. Take it away, Jill.
Thanks. So thanks for the opportunity to be here and talk with all of you today. So I'm going to be talking about my work that I've been doing now for the past decade, working in Asia to understand what are the impacts at the household level from cooking and heating with biomass fuels and coal on air pollution exposures, and as well as air pollution that's released into the environment and what that means for climate and population health. So I want to start out with two pictures from the province, one of the provinces where I work in China. So on the left-hand side, it's a Tibetan woman who's boiling water for yak butter tea, which is a delightful combination of exactly what it sounds like, butter, yak milk, as well as yak butter and a little bit of tea. If you're lucky, you'll drink it before it hardens at the top. If you're not so lucky, then you sort of take some yak butter down with your first or last sip. So she lives in a region where there's not a lot of wood, and so as a result, she's using yak dung as the main fuel, and she's adding a piece to the fire, so that's actually a piece of yak dung that's in her hand. And then on the right-hand side, these are two sisters. They're in a house in Yunnan province. It's in the morning. They're starting the fire for heating, so they'll use it for space heating. And then a little bit later in the day, their mom will come by and she'll put a pot on top of that fire, and she'll use that for cooking. And these scenarios are common in many, many, many parts of the world where people use biomass fuels. So I'll refer to biomass, and what I mean by that is wood as well as dung or crop residues or agricultural residues that people take from their fields. And they use them for cooking and heating. And I think probably many people in this room at some point in your life, you've sat around a campfire. So you know what it feels like when all of a sudden the wind blows and the smoke is in your face, right? It's uncomfortable. Maybe you're trying to move. You're waiting for the wind to change the direction so that the smoke goes in a different place. And about half the world's population lives in homes where they're cooking with wood, usually with minimal ventilation, often over an open fire. There may or may not be a window. There might be a small hole that's in the ceiling of the house that they're living in. And the smoke, it makes your eyes water, right? Women talk about, they get headaches. It's uncomfortable. It makes their throat hurt. But the sad thing is that it's almost viewed as just one of the hardships of rural life. It's unavoidable. There's nothing we can do about it. It's just one of the things that we have to deal with. So cooking over an open fire is one of the oldest practices in human history. When it actually began is still a question, but archaeologists have found in hunter-gatherer societies there had been evidence suggesting that people were using these a long time ago, right? And the domestic hearth is important. We sit around it. It's a social place. So this is also in Yunnan province. I think a lot of us have experiences where you have a dinner party, right? And all of a sudden at your dinner party, everyone ends up in the kitchen. And it's the same thing. So this is in Yunnan. It's at the end of the day. People have come home from their work, from being in the fields, and everyone's just kind of gathered around the fire. So even though that smoke is difficult and challenging to deal with, and it's uncomfortable, it's still part of the social fabric in a lot of communities. So reliance on cooked food also means that we're reliant on the fuel that's needed to cook that food. And so while for most of us that might just mean turning the knob on your stove, for people that are using wood and biomass fuels, that means they have to go out and collect that fuel. So they're either collecting dung, which they're then drying and using for fuel, or in this case, they're going to find wood or other kinds of crop residues that they can use to start their fire. And so these kinds of discomforts or some of the burdens that are associated with cooking with wood and biomass fuel, they're as much a part of the process of their life as cooking itself. So globally, about half the world's population cooks and heats with biomass fuel. And there's huge variability on this. So this is a map of the world. And in the darker colors, so in red, that is showing countries where up to 95% of the population is cooking with wood and biomass as their main fuel. So there's inequalities around the world with this. In sub-Saharan Africa, South Asia, Southeast Asia, there's a higher proportion of the population that burns wood and other biomass fuels for their primary cooking fuel. But I want to point to China, which is a country that just hosted in 2008 the Olympic Games. This is a country that has had massive development over the past several decades. And even in China, there's still about half the population that is cooking and heating with wood and coal. So I'm going to start by talking a little bit about what are the health and climate impacts of cooking with these fuels. What do we actually do about it? So if this is a problem, what are the kinds of energy interventions or fuel-based interventions that we can use to reduce people's exposures and the resulting impacts of that? And then how do we actually identify interventions that are going to work, right? This is still a problem. It's a big problem. So clearly the solutions that have been proposed thus far haven't been successful. So how do we actually have and identify effective solutions for communities? So wood is mainly carbon and hydrogen and oxygen. So why does it only emit CO2 and water when it's burned? And the problem or the culprit is incomplete combustion. So when you have incomplete combustion of biomass, it emits lots of different pollutants that are associated with health outcomes. I'm going to talk mostly about particulate matter, or fine particulate matter that's less than 2.5 microns in aerodynamic diameter. From a health standpoint, this is one that we're very concerned about because it gets deep into your bloodstream and in your lung. But there's lots of other pollutants that you might be familiar with things like benzoylpyrene, atrazine, known carcinogens, formaldehyde. So these are things that we hear about, and we know some of them are bad for our health, and they're emitted from wood smoke as well. In terms of the dose that people get from cooking and heating with biomass and coal, so this is looking at the inhaled dose of PM, or the estimated inhaled dose of PM, from different or common emission sources. So at the far left-hand quarter are studies of ambient or outdoor air pollution, as well as secondhand smoke. So secondhand smoke being if somebody's smoking a cigarette and you're sitting next to them. And then at the far end, this is on the log scale. So on the far right-hand side is tobacco smoking. That's the worst thing you can do, right, is just put the smoke right in your mouth and inhale it in. And household air pollution from biomass and coal, it falls in the middle, right? It's quite a bit higher than ambient air pollution and secondhand smoke. But the dose that you get is less than if you were smoking cigarettes. There's been a handful of epidemiologic studies that have been done trying to understand the health effects of these pollutants. Most of the studies have been done in women and children. And the reason for this is women and children tend to be the most vulnerable to pollution. So women are the most to pollution exposure. And the reason for that is women tend to be the primary cooks, not always. So in China, men also cook, the places where I work. And children are also at high risk because they're often with their mother. So these are the populations that we have health studies that have been done. And they are also the most vulnerable to exposure. So for women, we have evidence suggesting that exposure to these pollutants is associated with respiratory diseases, so things like chronic obstructive pulmonary disease, cancers, lung cancer, cervical cancer, digestive cancer. There's some evidence suggesting that it's associated with blindness, and specifically cataracts as well as trachoma. Some evidence that it exacerbates tuberculosis, makes you more likely to develop active tuberculosis. And then a lot of my work has been on cardiovascular diseases, so whether or not inhaling this smoke is associated with increased risk of blood pressure and the outcomes associated with blood pressure like smoke and coronary heart disease. For children, exposure to household air pollution is the single leading cause of child death under the age of 5 globally. So if you want to reduce child death, reduce household air pollution. It's associated with low birth weight. So mothers who are cooking with these fuels, they give birth to babies that are of lower weight. It's also potentially associated with stillbirth. And there's some evidence suggesting that kids that are exposed to that cooking smoke in their homes at a young age, at age 5 and age 10, have lower IQ than kids that aren't exposed to those fuels. So I'm not going to talk a lot about the health impacts work that we've done in China and India. This is one study looking at household air pollution and blood pressure. So when we first did this study, there hadn't been any evidence, or there was no evidence looking at the cardiovascular impacts. And given the growing cardiovascular disease burden in developing countries, and particularly in places like China and India, we wanted to understand if household air pollution might be part of that story. And so we enrolled women into a study, and we measured their personal exposure to air pollution. So on the left-hand side, this woman is wearing a pack, and that pack monitors her exposure to fine particulate matter, or PM2.5. And then we also measured their blood pressure and other things like socioeconomic status, diet, nutrition, physical activity, all of these things that are associated with blood pressure as well. We followed them over a course of a year. And that, on the left-hand side or right-hand side, is the relationship that we found between exposure to PM2.5 and blood pressure. Right? And so what I want to point out in particular is that this is not a linear relationship. Okay? So it increases and then kind of flattens out. It's a log linear relationship. Why does this matter? So this matters because of interventions, right? So it means that if we want to provide a benefit for people that are exposed to high concentrations, we need to get them down really, really low. This is not the only health outcome that this has been found for. It's the same for lower respiratory infections in kids. It's basically the first dose of exposure is really bad for your health. So it means you need to get people's exposure down to very, very low levels. I'm going to talk about black carbon in a little bit. So I just want to note that we also found that if you're exposed to black carbon, which is a component of air pollution, so black carbon is a component, it's soot, basically. It's a component of PM 2.5. And what we found in particular is that if you're exposed to black carbon, that health impact on your blood pressure is even greater. So it has a larger impact than some of the other types of pollutants that are in the PM that people are cooking with. This is a study that we did in India. So for this study, the woman, this is actually not a participant in our study, it's a volunteer. She's actually one of our field team members who is demonstrating for us. But she wore a monitor that measures her air pollution, so it was measuring her real-time exposure to black carbon. She also wears a blood pressure cuff for an ambulatory blood pressure monitor. So this is a monitor that essentially takes your blood pressure measurement every few minutes. Right? So in this case, it was every 10 minutes. So if you look on the figure, those are unfortunately a little bit small. So this is black carbon exposure and then time. So this is for 2 women. And over a cooking period, we measured their exposure. So in this case, at the beginning, the woman is cooking or sweeping. She lights the fire, her exposure increases, and then she's moving around the house, and there's changes in her exposure as she's doing that. And so what we did is while we were measuring her exposure, we also measured her blood pressure. So trying to look at if you have high exposure and an increase in exposure, do we see an acute change in your blood pressure? So this is a little bit different from the last study. So blood pressure is interesting in that we think that PM has 2 potential impacts on your blood pressure. One is that you're exposed to that PM, you're exposed to those fine particulates, gets into your bloodstream, and you basically have very acute vasoconstriction. And that leads to an increase in blood pressure. The other hypothesis is that over time, you're exposed to air pollution, results in inflammation, and you have a hardening of your arteries, and that leads eventually to higher blood pressure. So we're trying to test both. This one, we were looking at the acute effects. In the previous study, we were trying to look at long-term effects. So this is the change in blood pressure per unit change in air pollution at different minutes. So the first one is after 5 minutes of exposure. This is the change in blood pressure. After 10 minutes of exposure, this is the change in blood pressure after 15 and 20. So we did this up to 20 minutes. And what we found is that between 15 and 20 minutes after exposure, we started to consistently see an increase in blood pressure in the women that were enrolled in our study. So that's not a huge change. Right? This is between 2 to 3 millimeters of mercury. What does 2 to 3 millimeters of mercury mean? Lots of you have probably gone to see your doctor, your yearly checkup or physical. And so 2 to 3 millimeters of blood pressure is not that much for an individual. Okay? If you need to reduce your blood pressure, you're usually trying to reduce it by 10 millimeters of mercury or 15 millimeters of mercury. But this is the interesting thing about blood pressure. Any increase in blood pressure increases your risk of cardiovascular disease. And so in fact, in Asian women, so this is an exposure that affects the entire population, and in Asian women, a 4 millimeter of mercury decrease in blood pressure in Chinese women results in an 18% decrease in deaths from stroke and a 15% reduction in deaths from coronary heart disease. So because everyone is exposed to this at a population level, even a really small change in that health outcome can have very large population health impacts. Oops. So I've talked a little bit about the health impacts of household air pollution. Where does this rank globally? So these are, this was an assessment that's done actually every 4 years. looking at major risk factors and their impact on disease burden globally. So it uses a metric that's called a DALY. I'm not going to talk in detail about this because I could talk for days and days about DALYs, but essentially this is a metric that combines premature mortality and time that you haven't lived in full health, so you're sick. And if we look at household air pollution, it's the 4th leading contributor to disease burden globally, right? After smoking, high blood pressure, and dietary risk. And this is for the world. So this isn't for China, this is globally. And it actually exceeds outdoor air pollution. So I think we tend to hear a lot about outdoor air pollution, but the burden is actually much greater from household air pollution. And I just want to note, because I'll get to this a little bit later, this estimate actually only includes cooking. My first slide, I showed heating, and we don't have very good measurements of heating. So these estimates are really only based on cooking. If we included heating in this, that estimate would probably be larger. So household air pollution, it's a bit of a misnomer because it's not just in your home. It goes outside. So in these pictures here, you can see that there's this sort of cloud over the villages, right? So it's not a cloud, that's smoke. It's around 7 a.m. Everyone's started up their fires, and they're cooking. And so this is data that we collected. This is data from the Tibetan Plateau that we collected in June and July. So this is the indoor PM2.5 concentration for homes in this region that are averaged over 200 homes. And so looking at different times in the day on the x-axis, and the PM2.5 concentration on the y-axis. And so what you see is that in the summer, so in June, there's an increase in the PM2.5 in homes in the morning. There's an increase midday. And then there's an increase in the evening. So that corresponds with cooking, right? This is when people are cooking. And then if you look at January, it's quite a bit different, right? So in January, they start cooking, and then it kind of stays high and doesn't really go down until late into the evening. And even in the evening, it still exceeds what it is when they wake up in the morning. And that's because of heating, right? So people are cooking and heating at the same time. So if we look at outdoor concentrations, so this is from a monitor that's near the village but not within the villages where we work, we can see that there is an impact of household air pollution, or seems to be an impact of household air pollution on those outdoor concentrations. So you can look at around, I think probably the best example is around 6 p.m. You see an increase in outdoor concentrations around the same time, and we see the same kind of impacts in the winter. One of the pollutants that I talked about a little bit earlier was black carbon. So this is a pollutant that we'd measured in some of our health studies, and we'd found that it was more strongly associated with some of the health impacts that we were looking at. Black carbon is an interesting pollutant in that it is emitted from cook stoves. It's also emitted from traffic and industry, but it's emitted into the atmosphere, and its dark color is it absorbs sunlight. And as a result of absorbing sunlight, actually, I'll move back a little bit. So this is looking at the impact in Asia, specifically on black carbon. So on the left-hand side is black carbon that's emitted from multiple sources. So looking at biomass cooking, again, not heating, because we don't have very good measurements of heating to include from the emissions inventories. Fossil fuels as well as agricultural burning. And on the left-hand side it's the same as A, except it doesn't include biomass cooking. And the red colors mean that there's more, and the blue means that there's less. And so what we see is that there's a lot of black carbon in the region, and biomass in particular is a big contributor to that. So the black carbon, there's a couple things that it does specific to the Tibetan Plateau and in Asia. So I talked a little bit about how it goes into the atmosphere. And when it's in the atmosphere, it absorbs sunlight. So that actually has a regional climate warming impact. There's also evidence showing that black carbon, when it is on, it lands on snow and ice, and that leads to increases in glacial melting, and particularly, again, in the Tibetan Plateau and other regions in Asia. Those are the main ones. There's others that I think are talked about in some of the readings that I had given out today. But the good news about black carbon is that the bad news about black carbon is that it's estimated to be the second leading contributor to climate change and climate warming after CO2. But the good news is that unlike CO2, which stays in the atmosphere for a really long time, black carbon is a little bit like turning off a faucet. Right, so if you reduce the source of black carbon, it's removed from the atmosphere in a matter of weeks. So there's a very near-term benefit of trying to reduce black carbon and trying to remove it from the atmosphere. So given these health and climate impacts, what do we actually do about this problem? So the good news is that there are interventions, or actually, in the health field, we often say interventions, and I recognize that people often think of some reality television show where someone's like intervening. But when I say interventions, I'm usually referring to solutions. So things that we do to try and improve the situation. So interventions might be a policy, or it might be something that's a more targeted technology, like a fuel or a stove, to try and change the situation as it is. So I'll say interventions, and you can giggle if you want to, but that's usually the term that we use in the health field. So this is looking at a very simple graph of the relationship between wealth and fuel efficiency that we tend to see on a global scale. So if households are poor, they tend to use fuels like crop residues, dung, and wood. So the things that I've been calling biomass fuels. As households become a little bit wealthier, they'll start using things like charcoal. You have to purchase charcoal. Right? So charcoal is usually something that you're buying. It costs money, whereas wood and dung you're collecting. There's a time cost, but you're not necessarily paying for it. As well as coal. So coal would be something that as a household you're buying. And then as you move into wealthier, either move into urban areas, or as you gain more income, homes start using the fuels that we use. So gas or electricity as their main household energy fuels. And what I want to point out here is that more often than not, the transition from highly polluting fuels to clean burning fuels, it's not a clean replacement that happens, right? It's not a substitution. So usually what happens is people will start, as they gain income, they'll start using more fuels. So they'll keep using wood, but maybe they'll start using some additional fuels. And that transition tends to happen after a long time. China's a good example of that. So this is looking at energy use in China from 1979 through 1998. And the green fuels here are biomass fuels. So these are wood and crop residues. Orange is coal. And then yellow and red are electricity and gas fuels. And so if we look at 1979 to 1998, what we find is that the percentage or the total amount of fuel that people were using increased. So they're using more fuel, and they're using the same amount of coal and biomass fuels as they were in the 1970s, right? So they're using more fuel, but they've continued to use biomass fuels. And if we look at the percentage of the population in rural poverty in relationship to that, huge changes. There are large segments of the population in China that moved out of poverty during that time period. And so there's something about development it's not tracking, right? Energy isn't tracking with development in the same way that we see for other things. If I were to put water and sanitation up, this would look really different. But for whatever reason, energy doesn't seem to track as well. So some of the problems with fuel are income related. There's also access related, so you have to be at a place where that fuel is provided to you. So one of the alternatives has been, well, what if we try to just make biomass stoves that combust more cleanly? So people can still use the same fuels, but we just try to have more complete combustion, right? Because incomplete combustion is the culprit. So if you can try to have more complete combustion, that should help things. So this is looking at the relationship. So on the y-axis here is carbon monoxide. On the x-axis is PM 2.5. I don't want to spend a lot of time on this other than to say that all of these stoves have been classified at some point in time as improved stoves. But they're not really that improved. So you can see the traditional stove on the far left-hand side. There's some improvement when you move to a chimney stove or when you move to an enclosed combustion chamber. But these PM concentrations are still very, very high. And in fact, if you look at intervention studies globally that have been done to look at biomass stoves, so these are all the studies that have been done to date. And this black line here, it looks like it's the edge of the graph, but this is actually the WHO guideline. We haven't had a single stove or a single study that's met the WHO guideline, and we haven't even had a stove that's been able to meet the interim guideline, right? So that means that these biomass stoves, something's not working, right? We haven't been able to reach levels that are safe in terms of their air pollution, combustion levels, and we can't even meet the interim combustion goals. And this is in China, Southeast Asia, Pakistan, in the Americas, and Africa. It doesn't matter the stove, it doesn't matter the place. Every single intervention has failed. And so on one hand, if you look at this, from a climate standpoint, any reduction in PM or reduction in pollution is a good thing. But from a health standpoint, it's not the same story, right? Because if you want to improve health, so this is the relationship between PM and acute lower respiratory infections in children, which I talked about earlier. This is our study looking at blood pressure. And if you want to improve health, you have to get pollution exposures down to really, really low levels. So how do we actually do this? How do we design and develop interventions that can effectively reduce air pollution exposure at a population level, but also benefit climate? And the need of this is great. So there's about 650 million homes that currently use these highly polluting stoves and fuels. So we need to actually provide 650 million homes with some sort of solution. To put that in perspective a little bit, if we think about something as ubiquitous as the iPhone, there's been 560 million that have been sold that were sold up until 2015, right? So up in 2015, the iPhones, we still haven't reached the number that's needed to provide people with clean energy. So one of the things that we've been working with Chinese engineers on has been the design and development of stoves. So what I didn't talk about earlier is that a lot of the stoves that have been developed, it's sort of falling into NGO hands. And I think these are really well-intentioned NGOs. But if you think about vaccines, as a colleague once said, we don't expect NGOs to develop our vaccines. Why would we expect them to develop stoves, right? It's a really tough engineering problem. At the core, it's engineering and it's behavior. And so what we've been working with them on is trying to evaluate interventions as part of a process, right? So moving from technology development to laboratory testing of the stoves, into a rural energy lab. So the idea being that this is a place that mimics people's homes, but is still in a controlled environment, and then testing them in people's homes. And there should actually be an arrow going back, because then the process starts over again, right? And trying to integrate people as well as science into the process of developing interventions. So this is an example of the kinds of work that we've been doing on this. One of the studies that we did is we took what is called a semi-gasifier stove. So this is a stove that burns biomass, and it heats it, creates a gas, and then sets the gas on fire. And at the time when we tested it, everyone had said, well, these semi-gasifier stoves are great. All of them are great. They're fantastic. We should start putting them into homes immediately. And what we found when we actually tested them is that some are great, but some are really, really bad. So if you look, the red stoves are the ones that we tested. And some of the stoves were actually doing worse than even the traditional stoves, right? So trying to make sure that we understand not all stoves are the same, even if they're called the same name. We also tried to think about ways to systematically test behavior. So this is looking at, so at the time when we had initially done this study, this has changed since we did this study, the test that was used to determine whether or not a stove was a good stove or a bad stove didn't actually include the lighting period. So you'd test emissions of a stove in a lab, and then you'd start the test after cooking. And so what we found is that during the lighting phase, that's actually when a lot of the air pollution is emitted. Right? So you actually have to include the whole combustion process, from lighting to cooking to even putting out the fire, right? Because the person is there for that whole period of time. And then we also wanted to understand, well, what if you use the stove a little bit differently than the manufacturer recommends? So let's say if you're cooking, sometimes you want to cook on high power because you're frying something, but sometimes you want to cook on low power because you're making pancakes, right? And so what happens to the air pollution emissions if you change the way that you cook? And so we tested a bunch of stoves, and we found that for some of the stoves, they did really well at high power, but they didn't do so well at low power. And then the same for others. They did well at low power, but they didn't do well for high power. And so trying to develop a set of tests that people could use to try and test these things out. And then we also put stoves into people's homes. We had them use them. We asked them questions about the stoves, if they liked them. I mean, this is, like, we really just asked them if they liked them. And we asked them what they liked about them, and what they would like to change, right? If they're cooking with one type of fuel, why do they cook with that? And trying to make sure that they were integrated into the design. So not just the evaluation, but the design of the stove. So at the end of this, this is the stove design that the engineers that I work with at Tsinghua University came up with. So it's a semi-gasifier stove. And I should add to this, the reason why we looked at this kind of stove in particular is that the Chinese government had been promoting pelletized biomass as part of their 5-year energy plan, but they didn't really have stoves to burn it. So we thought, well, if you're going to have this as part of the 5-year plan, what if we can come up with a stove that can burn it so that it can burn cleanly and not result in putting an unintended consequence where we put highly polluting stoves and fuels into people's homes. So we have a stove that is an automatic lighter. It functions sort of similarly to LPG. It has an adjustable flame. It's multi-purpose, so it can heat water. It can heat homes. It can also, you can cook with it. And then after that, the whole sort of design phase and development had been done, which was a 5-year process with the Tsinghua engineers. We said, well, okay, let's try to actually test this in homes. So we'd been working for a while in the Tibetan Plateau. We knew the communities really well. And this was also an area where there had been one of the village-level biomass pellet facilities that had been built. So it was an opportunity to leverage the pellet factory because these stoves use processed biomass pellets to burn. In this area of China, so this is in Beichuan, Sichuan, people cook and boil their water with wood on traditional vented stoves. They also use space heating with wood and wood charcoal in fire pans that they'll leave out in their homes. And there's some ventilation. So you can't quite see it in this picture, but often the sides of the homes, the roof will go out a little bit more than the walls. So there's some ventilation in the homes, or more than you would have, certainly in places where I've worked in India. So the design of the study, and I should add, the study is ongoing, so I don't have the results of it. But I'll tell you a little bit about it. The design of the study is we had an intervention that had been developed by Tsinghua that fit within China's energy plan. We conduct baseline and post-stove intervention tests of air pollution and health indicators. We do laboratory analysis of biological samples and air pollution. And the goal is threefold. We wanted to look at whether or not these stoves resulted in decreases in air pollution emissions and exposures, whether or not there's an impact on climate forcing. So this is done by my colleagues at NCAR. and whether or not there's cardiovascular benefits of using these stoves. So we have 205 homes in 6 villages. About 115 of those homes, they actually just received the intervention this winter. And then we collect measurements of air pollution and health around every 6 months over a 3-year period. Our air pollution measurements, just to give you an idea of what this looks like in the field. So we take measurements of their wood. That's an IKEA bag. They're amazing for measuring wood. They hold up really well. They hold up better than any bag. So we use IKEA bags for measuring wood. We put air pollution monitors in their homes that measure PM, elemental and organic carbon, and a handful of gases. And we measure women's exposure. So they wear these exposure monitors for 2 to 6 days, and they wear them in the winter and the summer. And then we also collect a lot of information on health. So I'm an epidemiologist. I'm interested in whether or not there's a benefit, a health benefit of this. And so we're specifically looking at outcomes where we can see an effect over a short period of time. So things like blood pressure, arterial stiffness, thickness of the arteries, and other related cardiovascular indicators. And then we measure a whole lot of things that are associated with cardiovascular health. Just to give you a little bit of information about our study population. So, and I think this relates a little bit to what I talked about earlier with this idea that energy isn't quite tracking with development. So we enroll women into our study. On average, they tend to be a little bit older. Lots of young people move into villages. So the mean age is in their 50s. Most of the time, it's not multi-generational households. It's usually just one family living per home. A lot of them are farmers, so they own land. And the socioeconomic status is what I want to just chat about for a second. So these are homes that are cooking with wood stoves, so traditional wood stoves. 56% of them own a motorcycle, 21% of them own a car, and 22% of them own a computer and are also connected to the internet. Right? So again, this idea that for some reason energy isn't quite tracking with the normal development trajectory that we see. Secondhand smoking is also really common in this region, as it is in China, which has some of the largest smoking rates in the world and also a growing burden of lung cancer. I want to just talk about this briefly when this idea of stove stacking. So if you remember earlier, I talked about how often homes will use multiple fuels and stoves. So this is an example of that. This is looking at the homes in our study. And we have about 10% of our study population that's using a combination of 6 different stoves and fuels, right? Down to, everyone's cooking with wood, but lots of people are cooking with more than one. And I'm not going to present the results of this, but the somewhat unfortunate part about this is that if you burn a wood stove, it negates any of the air pollution benefit of those cleaner burning stoves. So once you start the fire, you start the fire. And so we don't see, in the measurements we've done, any air pollution benefit of using those cleaner burning stoves if you're still using the polluting stove. To give an idea of the concentrations that we see in people's homes, this is the 48-hour average concentration of air pollution. So in the summer, it's around 150 micrograms per meter cubed. In the winter, it's around 500. A really bad day in Montreal is 20. Right? The WHO air pollution guideline is 25. Their exposures are also quite high. So in the summer, it's around 100 micrograms per meter cubed, and in the winter, much higher. And that increases due to heating. So what we did is we took our measurements of winter and summer, and we used a global database that we had for China, and we tried to estimate the difference in premature mortality associated with cooking versus heating. Right? So all of these pollutants go outside, and so we have estimates for all of the provinces in China. We worked on this with colleagues at NCAR in Colorado to estimate what the impact was of winter heating versus cooking on outdoor air pollution, as well as its impact on mortality in China. So just to give you an idea, this is only from outdoor air pollution. Right? So this isn't household, when people are cooking. This is from the outdoor air pollution that's going into cities and going into other urban areas. 341,000 premature deaths associated with cooking and heating, and the impact of heating alone is 159,000 premature deaths. And those numbers for heating aren't currently included in the global burden of disease estimates that I talked about a little bit earlier. Right? We don't include heating. I encourage you to, we present all of our results to our studies on my website, which I think there's a link to on what I provided. So our study in the Tibetan Plateau, it's ongoing. The intervention is being evaluated over the next couple years. So all of those results will be posted. If you're interested in seeing what happens with this study, then I encourage you to take a look at my website, and all of that information will be there. Just to quickly wrap up, I think the unique thing about clean household energy is that there's really an unprecedented opportunity to implement clean energy in homes and benefit both global health and child health in particular, but also climate. And there's solutions that exist for all of these things. Right? We have known solutions. We all, none of us, or maybe few of us, I shouldn't make that assumption, don't cook with wood or with coal. But in many cases, we may have earlier in life, or we may have family members that did at some point in time. So there are interventions that work and can reduce household air pollution. But then the question is what to do for people who are not quite going to get to a point, either economically or logistically, where they're able to get access to these really clean burning fuels. And I think there's a need to try and do comprehensive testing and iterative engineering to identify interventions or identify fuels or stoves that can be used that function the way that people want and expect them to, and that ultimately reduce their exposures. I want to just quickly acknowledge my collaborators, and I will open it up for questions.
Thank you very much, Jill. You showed a global map early on in your presentation with a fairly substantial part of the developing world doing biomass cooking. And this is also one of the key areas of the world that happens to be quite vulnerable to the effects of climate change. So to prevent this double whammy effect, what sort of economic programs are necessary to provide alternatives to biomass cooking? Because you've been focusing some on China, and presumably the government is intervening there. Yeah. But other countries may not be so fortunate. What are the alternatives?
Yeah, I mean, so I will say, for things like, I can tell you what's being done, and I can tell you sort of where I think we should go. So a lot of the effort there's been effort put into carbon, whether or not we can fund it through carbon finance. So if these are producing climate-relevant pollutants, then what if we were able to deal with those in the same, pay for cook stoves or pay for interventions through some of the carbon finance mechanisms? But since those markets have not done particularly well since 2011, 2012, that hasn't been a very viable solution. There's many governments that are interested in trying to address the question and are putting money towards it. I mean, I guess my general feeling on this is that, and I'm borrowing this from a colleague as well, sort of similar to what I mentioned earlier, but we subsidize vaccines, right? Because countries subsidize vaccines and because they prevent child mortality. And so maybe we need to start thinking about energy in the same way that we think about vaccines as a preventative measure that we should put funding towards, governments could put funding towards.
Okay, from a closer to home perspective, do you have any feel for how severe the indoor air pollution problems are in Canadian homes, even though they don't do biomass burning?
Yeah, I mean, we moved into our house I moved to Montreal 3 years ago. We moved in and there was a biomass stove in the basement. My spouse always gives me a hard time because I won't let him turn on the stove and burn wood in it. And the reason is that stove actually produces the same kind of pollution that homes in China are producing. And that pollution would leave our house. It would go onto our community. And that contributes to outdoor air pollution, which is associated with increases in cardiovascular events in populations in Canada. And so the evidence for Canada looking at, I should take a step back and say the evidence in Canada for looking at cardiovascular events specifically associated with wood smoke is unclear. It's a little bit hard to tease out wood smoke from other sources. But there definitely is evidence in Canada that there's about 7,000 premature deaths every single year from exposure to air pollution. And so it's the same thing. And if you have a wood stove, the EPA has a really nice list of stoves that burn cleanly that you can put in your home, and you're not going to be exposed to high amounts of air pollution, and your neighbors aren't going to be exposed to high amounts of air pollution either. Okay, so this is one question that relates to the so-called culture of cooking in many of these countries. How can this be changed ultimately? I think one of the things that we've been, and I should say the evaluation work that I was talking about with the stoves in China, so we evaluate, right? So we try to come up with tests and things like that should be used, but the credit for the changes and development of these stoves, it really goes to my colleagues at Tsinghua University who have been using this different approach to developing new technologies. And I think their goal in the process of trying to develop these stoves has been, people like LPG, right? LPG it's a good fuel in that it's easy, it lights quickly, they don't spend a lot of time on it, it's clean. There's lots of good things about LPG, but it's expensive, right? So you have to buy it, and there's transportation issues. And so their goal in trying to deal with culture is saying, or trying to address culture is saying, look, people like this. We're going to try to develop an intervention that is as close as we can get to the best possible cooking fuel, right? And then that was their goal. Like, we knew people liked LPG, they knew people liked LPG, and then it was trying to get to that. And I think ultimately the goal is you need to have a stove that performs in the way that people expect it to. A lot of these biomass stoves that have been implemented, they break quickly. You can't cook in the same way that you were cooking, and you just can't do any of those things, right? If you have an intervention that's going to break or that people have to change their cooking habits, they just won't use it, right? My parents had moved, they moved to New York, and they had to switch from LPG to electricity, and I've heard about that transition now for 3 years. Every time they visit us, they're like, it's so difficult, we have to do, and this is, that shift doesn't even seem as big as moving to, can you imagine if you have to cut up the fuel into smaller pieces, if you have to cook different foods, right? That's a game changer for people.
Absolutely. Okay, we have a question about whether acid rain is the result of air pollution owing to the cooking by wood-burning stoves.
So it's mostly SO2, and certainly some of the air pollution impacts from household air pollution. So the black carbon that's in the air, it's visible, right? So you can see that. But in terms of acid rain and those impacts, most of that is coming from SO2.
Okay. So the interventions that have been occurring in China, are these primarily related to political motivations or scientific? To what extent is the government responding to scientific evidence?
China's an interesting place in the sense that, so I'm from the U.S. And live in Canada now, but I feel like often probably more so in the U.S., as scientists, we're really trying hard for policymakers to get our research, right? We have to try every single venue that we can, listen to us, we have an important message. So in China, scientists actually write policy. So colleagues that I work with in China are directly involved with writing China's energy, 5-year energy plan. So there's really direct links there. In addition to that, the scientists in China also play a key role in evaluating policies that the government is either thinking of or proposing. And so in the case of our study, it's largely related to the government's plan to implement or promote pelletized biomass, which is what these stoves run off of. And so it was the hypothesis and the study was really designed around that policy decision.
So I guess the question here is one of economics. Who actually has been paying for the stoves and their installations?
Yeah, that's a good question. This particular study, it's mixed. So in this region, there was, so I don't know if people remember, you can nod your head if you do. In 2008, there was a big earthquake in China. Yeah. So this is where the 2008 earthquake happened, this site. So actually the village where we work, if you stand at the edge of right here, so that area in the back there, that's actually the city that was on the news when that happened, where there was hundreds and thousands of people that were impacted by that. So as a result of that, there was a lot of development that happened in the region because there was a lot of rebuilding that needed to happen. And so one of the reasons why we selected this site for our study, in addition to the fact that I knew it really well because I'd worked in the region for a while before that, was that there was support for clean energy in the region. So part of the study is covered through the reconstruction and redevelopment activities that were happening there post-earthquake. And then the other part is funded through other government support. So local government support, regional government support.
Okay.
Yeah.
Well, thank you very much
Thanks.
for answering a variety of questions.
No, thanks for the great questions.